Good morning, everyone. I am Dr. Murali Chand from India. Now I am going to explain the abnormal course of the facial nerve, that is, facial nerve variations. It is divided into four parts. The first is the variation in canalicular part of the facial nerve, and the second is the variation in the labyrinthine part of the facial nerve. Third is the variation in the tympanic part of the facial nerve. Fourth is the variations in the mastoid part of the facial nerve. First, let us concentrate on the tympanic part of the facial nerve. Okay. Mainly, there are three structures. One is oval window and posterior crura origin, anterior crura origin. So this is the total is the oval window and round window. It is divided into four quadrants and lateral semicircular canal. So mainly when we are discussing the facial nerve variations, three main structures are there. One is lateral semicircular canal, oval window and round window. So the normal course of the facial nerve is in between the lateral semicircular canal and the oval window, that is the tympanic part, and the second genu. This is the tympanic part and this second genu. This is the vertical part of the facial nerve. This is the labyrinthine part of the facial nerve and this is the internal auditory canal part of the facial nerve. Now, first let us discuss the variations in the tympanic part of the facial nerve. So, at the second genu area, the tympanic part goes above the lateral semicircular canal and meets below the lateral semicircular canal, the vertical part of the facial nerve. So this is the normal course of the facial nerve, and the first variation of the tympanic part of the facial nerve is it goes above the lateral semicircular canal. Again, next variation is it goes over the arch of the footplate of the stapes above the crura. That is the second variation. And the third variation is it may go in between the crura and meets the vertical part of the facial nerve. So the first variation is the tympanic part of the facial nerve goes above the lateral semicircular canal. That is the first variation. Second variation is it goes above the arch of above the footplate of the stapes and meets the tympanic part of the mastoid part of the facial nerve. And the third variation is it goes in between the two crura of the stapes and meets the vertical part of the facial nerve. The fourth variation is it is inferior to the footplate of the stapes and meets the mastoid part of the facial nerve. So this is the first one. This is normal position. This is the third one, second variation, third variation and the fourth variation. And the fifth variation is it goes in between the oval window and round window and meets the vertical part of the facial nerve. 1, normal, 2, 3, 4, 5. And the sixth variation is it goes below the round window and becomes the mastoid part of the facial nerve. 1, 2, 3, 4, 5, 6. So the variation is, the first variation is, it goes above the lateral semicircular canal and becomes the mastoid part of the facial nerve. Second is, it stays above the crura of the stapes foot plate and becomes the mastoid segment. Third variation is, it goes in between the crura of the foot plate, crura of the stapes. Final variation is, the final variation of the tympanic part of the facial nerve is, it splits. That means the tympanic segment splits into two parts, one above, one below the foot plate, and they meet together at second genu. The upper part may be thicker and the lower part may be thinner, or both may be in the same size, or the lower part may be thicker, upper part may be thinner, or this upper part may pass in between the crura of the stapes. So the facial nerve splits into two parts, one above the stapes foot plate, one below the stapes foot plate. The upper part may be thicker, the lower part may be thinner. The upper part may be thinner, a lower part may be thicker, or both of equal thickness. Or another variation is, this upper part may go in between two crura of the stapes foot plate. So these are the variations of the horizontal part of the facial nerve, that is the tympanic part of the facial nerve. Next I will explain the variations in the vertical part of the facial nerve. So to summarize, the first variation is, it goes above the lateral semicircular canal and becomes the mastoid segment of the facial nerve. This is the normal course in between the lateral semicircular canal and the oval window. The third variation is, it prolapses and stays above the stapes foot plate and becomes the mastoid segment. In this situation, it stays above the both crura. Or in another situation, another variation, that is the third variation, it goes in between the two crura of the stapes foot plate. And the fourth variation is, it goes below the foot plate. And the fifth variation is, it goes in between the oval window and the round window. And the sixth variation is, it goes below the round window and becomes the mastoid segment. And the last variation is splitting of the tympanic part of the facial nerve. It may be splitted in equal proportions, that means equal sizes, or the upper part may be of thicker size and the lower part may be a thinner size. The upper part may be thin size and the lower part may be thick size, or the upper part may goes in between the two crura of the stapes foot plate and meets at the second genu. Okay, this is the Proctor book. So what all I told right now, the variations of the horizontal part of the facial nerve, everything from the Proctor book. This is a wonderful book. See the splitting of the facial nerve in this diagram. See, it splits in both, it splits above and below the oval window. So initially it's splitted like this in these three diagrams. In this diagram, it is splitted like this, and the splitting extended up to the second genu. See here, the splitting extended up to the second genu and meeting together and becoming the vertical part of the facial nerve. So in this diagram, the upper part is the thick. The upper part is the thick one. Lower part is the thin one. In this, both equal sizes. In this, upper part is thin, lower part is thicker one. Immediately behind, in these three diagrams, immediately below the foot plate, they are meeting. But here, the bifurcation extending up to or below the second genu, and there it is meeting. That is the difference. Thank you. Okay, now I will explain the facial nerve variations in the vertical part of the facial nerve. Mainly three variations are there, three categories. One is facial nerve following an abnormal posterior, lateral or anterior course. That is first one. The second one is bifurcation or trifurcation of the facial nerve. And the third one is the hypoplasia of the facial nerve. Three categories. Now I will explain everything in this line diagram. The first most common variation is dorsal hump. That is hump just below the lateral semicircular canal. That is the most common variation. And next one is, this is posterior curvature. Like in the same way, anterior curvature. Some suggest they call it as S shape of the facial nerve, like this, S shape of the facial nerve. This is at the pyramidal process, this anterior lobe. This is the posterior lobe. This is the dorsal hump below the lateral semicircular canal. This is loop below the pyramidal process. Okay. Next, this vertical part of the facial nerve sometimes you may not see in cortical mastoidectomy. In such a situation, at second genu area, it curves anteriorly and goes above the foot plate. So this part of the facial nerve, that is the mastoid part of the facial nerve, cannot be seen in such a situation. So the mastoid part of the facial nerve is agenesis. In such a situation, at second genu area, the facial nerve turns anteriorly and stays above the foot plate. Next variation is the vertical part of the facial nerve goes anteriorly above the round window or over the round window. So, two situations where the mastoid part of the facial nerve cannot be seen in the cortical mastoidectomy. In both the situation, the facial nerve is going anteriorly. And next is, this vertical part of the facial nerve goes very posteriorly and stays above the sigmoid sinus, lateral sinus. That is the sigmoid sinus. So this is in this variation, the facial nerve is above the sinus. And next is bifurcation and trifurcation. Bifurcation and trifurcation. All the three may go in a separate stylomastoid foramen, or again they meet together, bifurcation or trifurcation. They meet together and the final thicker part goes out of the stylomastoid foramen. So the last variation is bifurcation or trifurcation. They may leave the mastoid in a separate stylomastoid foramens, or they meet and the thicker part goes through the stylomastoid foramen. And the last variation is This vertical part of the facial nerve is so thin it is atrophic. Up to here, the horizontal part of the facial nerve and up to second genu, it is very thick. This vertical part of the facial nerve is very thin. That is hypoplasia of the vertical part of the facial nerve. So, the variations of the vertical part of the facial nerve is divided into three categories. The first one is abnormal posterior, like this, or abnormal anterior, like this, or lateral, abnormal lateral inclination. That means this vertical part of the facial nerve is inclined laterally when you see from posterior. It is inclined like this. It is not directly going straight, it is inclined. So that is abnormal lateral inclination. That means when you are doing canal wall down, you have to be very careful when you are reaching near to the stylomastoid foramen. You should not go the same depth as you go at second genu area. You have to be very careful here. There is lateral excursion of the vertical part of the facial nerve. That lateral excursion may be abnormally lateral excursion. So here it goes laterally. So abnormal posterior facial nerves, abnormal anterior variations, abnormal lateral excursion variations. That is the first division. Second is bifurcation and trifurcation of the vertical part of the facial nerve. And the third one is hypoplasia of the vertical part of the facial nerve. Three categories. Thank you. Okay, some of the additional points regarding the variations of the facial nerve. See in this diagram, this is persistent stapedial artery. See, abnormally large persistent stapedial artery associated with very thin facial nerve. This was described by Dr. Proctor. So, abnormally enlarged persistent stapedial artery along with very thin facial nerve. And here, this is the S-shaped deviation of the facial nerve, and the very thicker chorda tympani attaches to the facial nerve just below the foot plate. And see this one, the vertical part of the facial nerve is abnormally posterior, and it is almost over the sigmoid sinus, and it is in between the sigmoid sinus and external canal. And in this bifurcation and trifurcation, one is thicker, that is the thicker one is lateral and thinner. Usually the thicker one is lateral and thinner is medial. This chorda tympani usually attaches to the thicker one. See here, it is bifurcation, and one is very thin. This is very thick. This chorda attaches to the thicker part. This chorda attaches to the thicker part. And the most common variation is the dorsal hump below the lateral semicircular canal. In this situation, when we are opening the antrum, we may injure this dorsal hump. So when we are doing the cortical mastoidectomy, we have to be very careful. Just below the lateral semicircular canal, there may be variation of dorsal hump. And at last, there are variations of canalicular segment, that is internal auditory canal. Canalicular segment of the facial nerve, variation of the canalicular. This, instead of passing to the internal acoustic meatus, it goes to the subarcade fossa and through the superior semicircular canal. See here, it is coming from subarcade fossa and it is going through the superior semicircular canal and it is becoming vertical part of the facial nerve. So, in this bone, this is internal auditory canal. This is arcuate eminence. And this is subarcade eminence. And this is vestibular aqueduct. That means endolymphatic sac opening. This one. This black area. This one. This opening. This is subarcade opening. Instead of this, it goes to this one. So this is arcade eminence is superior semicircular canal. So this subarcade eminence is the central point of the superior semicircular canal. So it enters through this and goes to the superior semicircular canal. And sometimes instead of one facial nerve, you may see two facial nerves in the internal auditory meatus itself. And the last part is labyrinthine segment of the facial nerve. It may be bifurcated. The labyrinthine part of the facial nerve may be bifurcated. So, we have to know the variations of the facial nerve in 4 areas. One is canalicular segment of the facial nerve. Another is labyrinthine segment of the facial nerve. Third is the tympanic segment of the facial nerve. Another is the masthead segment of the facial nerve. Okay, this concludes the variations of the facial nerve. Thank you. So, what all I told until now are abnormal course of the facial nerve courses. Along with that, this is the normal course of the facial nerve. To this normal course, a slight deviations may be present. That is, slight anterior, especially this masthead segment, slight anterior, slight posterior, or slight medial, or slight lateral excursion, outward oblique direction. So here it is a normal course. Here a slight posterior curvature. Here also a little bit angulation. Here in this diagram it is slight lateral excursion. This is the variation. See, slight excursion. In the same way it is slightly medial also. So this is normal slight variations. Okay, thank you. Bye.